Welcome to BIC Talks, a podcast brought to you by the Bangalore International Centre. BIC has fostered over 250 informed discussions, dialogue, and cultural enterprise in its new premises since 2019. BIC Talks bring ideas and conversations ever closer to you.
Hi, I'm your host Pawan Srinath, and also with me is V. Ravichandar of the Bangalore International Centre. We are recording this on March 31st as we complete one full week of the 21-day national lockdown to contain the COVID-19 pandemic. How are Bangalore and Karnataka's healthcare systems gearing up to be prepared for a COVID-19 outbreak? How can we provide the best of care for people affected by COVID-19? And how do we ensure that Bangalore and Karnataka have enough hospitals, medical professionals, personal protection equipment, and more over the coming weeks? Dr. Sudarshan Ballal, chairman of Manipal Hospitals and the president of NAT Health, and also a part of the COVID-19 national group, joins us on episode 3 of BIC Talks. Dr. Ballal, thank you so much for joining us today.
Good morning, Pawan and Ravi. It's a pleasure to be here. And I think this is a time that we need to disseminate as much of accurate information as possible about COVID-19. You asked a very relevant question. How do we sort of protect people from COVID? And how well are we geared to treat people with COVID? And my one-line answer is that we should try to prevent people from getting COVID. If they do get it, prevent them from getting into hospitals. And if they do get into the hospitals, try to make sure that they don't have to go into the ICU on a ventilator. And the reason I say that is that it is most cost-effective and the most useful for us if we can prevent COVID from spreading like wildfire. And fortunately for us, it has happened to some extent in India. Maybe it's the lockdown and many other issues that have helped. If you look at a country of 1.35 billion or 1,350 million, we have 1,000 plus cases, which may be one of the lowest in the world, very few deaths. And our own experience in many of the hospitals is that you hardly see anyone getting into the ICU or a ventilator on COVID. So the point is, I think we should prevent it from spreading. It's like a toxic gas that needs to be in a special container. And here, the container are lockdowns at home, isolation at home, social and physical distancing. So if we can prevent the disease, that's the best part. And if by any chance you develop the disease, then try to manage them at home as far as possible. It could be either your own home or could be a non-hospital supervised quarantine or isolation facility. And that is what we have been requesting the government. Even though we have reasonable amount of health care and the Karnataka government has been very proactive, and Karnataka is one of the more progressive states as far as healthcare is concerned. We probably have more medical colleges in the districts of Udupi and Dakshina Kannada, more than many of the large states in India. So we have a fairly large number of hospital beds, large number of trained personnel, and large number of doctors, and about 1,200 or so ventilators in the state of Karnataka. But my point is we should make sure that people do not get into the stage of getting into the ICU and the ventilators. And isolation, isolation, and isolation is the mantra in preventing the spread of COVID and breaking the chain of transmission.
Thanks, Dr. Ballal. Immediately, whenever we think of health, we think of healthcare. And when we think of healthcare, we think of hospitals. And thank you for reminding us that we have to start from the basics. And so long as we prevent it, or if we can't prevent something, if we can contain it and manage it and not end up at the hospital, we'll all be better off. So in this, Dr. Ballal, I want to take a step back. And we know that we have several respiratory illnesses and infectious diseases that are common and prevalent across India, including Bangalore and Karnataka. So we've seen influenza, H1N1, we have COPD in many older people, pneumonia, and so much more. So could you help us understand COVID-19 and perhaps some of the severe effects that this could have in the context of respiratory illnesses that are already there in our general public?
If you look at the respiratory illnesses, not only in our city, state, and the country, but across the globe, there are many corona-related kind of viruses that are floating around which have had infections. We, of course, have the regular influenza-like illness every season, and now we have vaccinations every year for the influenza-like illnesses. Of course, we had the SARS epidemic, which was a big scare, but certainly was well contained at the end and didn't create the kind of scare corona has created. We had the swine flu and many other respiratory illnesses, most of them viral. And even the common cold is a viral disease. And all of these are respiratory illnesses. They have many things in common. One is most of them, not all of them, are only spread by person to person transmission by sneezing, coughing, so on and so forth. And second is what's called as a fomite spread. And I do not know how many of you have watched the movie called Contagion. When you sneeze or cough, your droplets usually can go up to a meter. So anyone who's within that radius can sort of get the droplets, and that can get into their mucous membranes of the mouth, the nose, and sometimes the eye, and the person gets the infection. The second thing is when you also sneeze and cough, you contaminate the surfaces around you. It may be your table, it may be your chair, it may be the lift, it may be the staircase, and someone else touches that and touches their nose or mouth, and it spreads to them. So this is one thing, commonality about all the respiratory viruses, the way they spread from an individual to another individual. And somewhat the symptoms of many of these respiratory viral illnesses are very, very similar. Most of them starts with a itchy throat, some runny nose, sneezing, coughing, headache, fever, sometimes chills, and overall feeling down and out. So this is very common for most respiratory illnesses, including the flu, H1N1, etc., etc. Some symptoms of COVID that are a little different is that COVID usually presents with high fever, does not have much of a runny nose or itching of the nose, and usually the cough is dry and not productive, and shortness of breath because your lungs are inflamed, filled with fluid, you cannot breathe. So fever, shortness of breath, and dry cough, along with body ache, headache, are more common in COVID-19. But obviously, the symptoms alone are not enough to hang your coat on. You need more history, especially history of travel to areas which might have had COVID-19, history of contacts with patients who might have had COVID-19, history of being a healthcare worker who's taking care of people who could have potentially had COVID-19 are all important to make a diagnosis in addition to the testing.
Thanks, Dr. Ballal. So, say perhaps this was March 2019, or if COVID was not happening. We know that while respiratory illnesses can to a large extent be managed at home, managed with some primary care, especially with people who are more vulnerable or have other ailments and are older, they might have to be hospitalized. So, could you give us a sense of how this is if COVID-19 was not there at all? Who would be coming to Manipal? Would ICUs and hospitals be fairly well filled with people suffering from respiratory illnesses? Are they very common that way?
Most respiratory illnesses are seasonal. Usually the flu season is during the winter all across the globe. And of course, we do see a lot of respiratory illnesses during season of viral illnesses. And sometimes our ICUs are about 80 to 90% packed with various respiratory illnesses, in addition to other serious patients that we see being a quaternary care hospital. But respiratory illnesses are common. And as you rightly pointed out, elderly people, people with debilitating diseases, diabetes, hypertension, cardiac disease, kidney disease, low immunity, maybe transplants or immunocompromised for other states, chronic smokers, people with COPD are all more prone, and they're the ones we need to be specifically targeting to prevent this illness. And all over the world, including Italy, you see that the mortality is the highest in the elderly and the debilitated. It may affect the other populations, but usually they get over it. It's only the debilitated and the elderly that we have to be extra careful and make sure that they are kept aloof so that others don't infect them.
So, Dr. Ballal, many of the causes for some of the respiratory illnesses are also infectious and contagious, right? So, how do hospitals prepare to, while they're treating patients, ensure that the infection doesn't spread within the hospital ecosystem? And how much more care do we need to take with a disease like COVID-19?
See, the point is that COVID-19 is quite infectious, just like the common flu. And anyone with a respiratory illness that is likely to spread to someone else and could have serious consequences, we take the same measures as I mentioned earlier. If you're in the community, social and physical distancing, cough etiquette, sneeze etiquette, not spitting, cleaning your hands frequently, cleaning the surfaces around you, and also trying not to get into places which are crowded is something that we would do at a community level. And at the hospital, we would triage them as and when they come, especially in seasons like this. There would be a specific area where a patient with a suspected COVID or any other serious respiratory illness would be there. And with the history, they would be seen by people wearing protective equipment, mostly healthcare workers in the form of doctors, nurses, or paramedical personnel. And they have a standard protocol to follow. Then you would do the necessary tests, including a nasal swab or a throat swab, as may be the case. And then, of course, depending on whether they're sick or relatively asymptomatic, they're either sent home to a hospital isolation bed, or if very sick, into the hospital ICU with an isolation facility. That's the protocol we follow, not only for COVID-19, but any other serious respiratory illness. We did the same during SARS, we did the same during swine flu. But for some reason, COVID-19 has spread across the globe much more than any other previous pandemic that we have witnessed. Maybe the Spanish flu in the 1918s was like this, but in the recent past, I have not seen any disease that spread across the globe and created so much of panic, at least in the last 30 to 40 years of my practice.
Thanks, Dr. Ballal. Here's a question that I think is running through many people's minds, especially here in Bangalore. Supposing somebody at home, a loved one, is suffering from some kind of a respiratory illness today. It is COVID-19 all around. There are government helplines and so, but for most people, they still go to the hospitals that they trust, and many come to Manipal and have a long family history of coming to hospitals like Manipal. So today, if someone comes up in an ambulance or lands up in ER, one of the concerns very early in this was some of the individual stories, like the first case from Karnataka where they had to go from hospital to hospital. There was a lot of concern about people maybe missing quality care. So could you give us a sense of today, if somebody ends up at a hospital, what kind of systems are there such that people are taken care of well? And if they are indeed COVID positive, then they're treated and taken to the right government or private facilities to take care of them.
So my suggestion to anyone who has a respiratory symptom in these days of a COVID scare, first of all, I think you must practice isolation, whether it's COVID or not, any kind of respiratory illness you have, as far as possible. Do not infect the people around you till you have a more definitive answer. And in these days of lockdown and people who need to be staying at home, my suggestion is, instead of rushing to any hospital, if you are not very sick, call your doctor or any healthcare personnel that you are in touch with and seek advice for them. There's no point in rushing to a hospital every time you sneeze or you cough.
Absolutely.
We actually discourage your patients from coming to the hospital, other than people who are really ill and then obviously need to be seen in the ER. So the best thing is, if you have a cold and cough, isolate yourself, call your doctor, and then preferably go to the nearest hospital possible, because we need to cut down travel as much as we can. And fortunately for us, the government of Karnataka has opened up a host of government hospitals for COVID. They have now opened up fever clinics. And more importantly, they have dozens of private hospitals also listed where COVID patients can be seen. So you can go to the nearest hospital of your convenience if you have to go to the hospital at all. If you can manage from home, that is the best option.
Thanks, Dr. Ballal, because we do feel like rushing to the hospital a lot, and it's important to stay home. Then we don't want to unnecessarily overload the hospital system with non-serious cases, but rather reserve the care and attention that is needed for those who are in most need of it.
On a lighter note, I think now most doctors who get a call, first is they find out if they can keep them away from the hospital. So we discourage patients from coming to the hospital unless they are very, very sick. And of course, most hospitals have ramped up their teleconsultation facilities like we have done. And a lot of things that we can do on the teleconsult is what is needed right now. No need for a face-to-face meeting in these times of crisis.
So my next question, Dr. Ballal, I want to talk about ventilators, ICU beds, and also about PPEs. So maybe first about PPEs, or the personal protection equipment. We are hearing a lot of news about how there's a severe shortage of this across the country. There's also concern that when it comes to things like masks, there's a lot of private fear and concern. So people want to stock up on their own while we need them for medical personnel. What are the kinds of resources? Could you give us a sense, if somebody gets admitted with a respiratory illness, what's the quantum even of these kinds of equipment that are needed? And how can we really ramp up supply in the country to meet the demand in case the worst case scenarios happen?
No, that's a very good question, and the question that's in the mind of most citizens in this country, mostly about personal protection equipment for ICU beds and the ventilator. In my opinion, I think the personal protection equipment is probably of prime importance. and probably also the one that more likely to face the scarcity with. I think at these times we need to prioritize. I think the most important people who need personal protection equipment are the frontline healthcare workers who deal with patients either in the emergency room, in the ambulances, in the wards, or in the ICU. They need to be protected. And I must also add in the operating rooms. They are the ones who personally need to be protected for many reasons. One is, of course, they are the ones at the highest risk of getting it from someone who's sick. Secondly, all over the world, we have seen that the infection rates among healthcare workers has gone up, which we need to prevent it. The third is if these guys get infected, not only are they out of action, which means a large number of patients cannot be taken care of, anyone with contact with them, which is mostly their colleague, co-workers, also will be quarantined, which means we lose a huge amount of the health task force in our war against COVID. So I think our primary aim should be to protect the frontline healthcare workers, because if we lose them, more patients will be harmed than helping anyone else. So the prioritization is for healthcare workers, which doesn't necessarily be doctors alone, just nurses, paramedical personnel, ambulance drivers, so on and so forth. Secondly, it will be for people who actually have a cold and cough or a COVID-19 infection so that they do not spread it to others. All the rest would be low down in the priority. And in my opinion, if you today tell me that every Indian should wear a mask, that is 1.3 billion masks per day. I don't think the entire planet can produce that many masks if that's the only thing they do in their life. So I think we have to be cautious, not alarming in our disposition of saying everyone needs to wear a mask. Let us prioritize our scarce resources and use it very judiciously. Just to give you an example, any COVID-19 patient admitted to the ward for isolation will have at least 3 to 4 PPEs used for that person per day. This number will change quite a bit if the person is in the OR with a complex case and multiple surgeons, multiple anesthetists, multiple nurses have to be in the OT. And so also in the ICU, if someone is critically ill, multiple healthcare personnel will have to visit this patient at different times. So it will exponentially go up on the use of PPEs. So let us preserve scarce resources like PPE for the people who need it the most. As far as ICU beds and ventilators are concerned, I do hope that we don't reach a stage where there's an exponential rise in the COVID cases, like what they say, the vertical line of the J curve. Because if that happens, no country, including the mighty United States, can cope with it. So our best bet is to prevent the numbers from going up. Even if the numbers go up, let's make sure we take care of most of these people, which is about 80 to 90% of them, at home or non-hospital based supervised quarantine or isolation facilities. Let us reserve the hospital and the ICU for the only ones who deserve it. And let's hope those numbers don't go up. We certainly can ramp up the use of ventilators and other breathing devices, but also we need to ramp up the infrastructure of ICU beds, hospitals, and most importantly, we have to ramp up the infrastructure of trained personnel, which we cannot produce overnight, like doctors, trained medics, trained nurses, so on and so forth. So it's a tough task to meet everyone's demand. So I think our aim should be to reduce the demand by reducing the spread of COVID and breaking the chain at home rather than spreading it to the community.
Dr. Ballal, just on the issue of masks, that is one area where we have had conflicting advice. In the initial months, it was very clear that the ordinary person does not need to wear masks. It's required for those who are infected or healthcare professionals. Now we are seeing very express instructions, including the police enforcing it, that you can't step out without a mask. So how do we reconcile these conflicting pieces of advice, taking the mask as an example?
You have brought in a very useful point. I mean, I've been on these kinds of programs for the last few weeks. And when it started, all of us, I think, including the regulatory authorities, had said the prioritization of masks is only for healthcare workers and for people who actually have the disease and not spread it to others. Then in between, the WHO came up with some doubts whether there was an aerosol spread or whether the virus could be up in the air even when someone is not sneezing or has gone beyond the stage of sneezing or coughing and the virus remains in the air. And hence, I think more and more people now have been recommending the use of masks for everyone. And I believe the police are also stopping people who are sort of coming out without a mask. Now, this is a very difficult question to answer because one is there is no way we can have everyone in this world get a mask. I think physically that would not be possible. My own suggestion is use common sense, prudent measures. If you're likely to be exposed to a large number of people, or if you are going to be exposed to a large number of people when you go out to crowded places like groceries or wherever, try to wear a mask. Do not wear a mask if you're just sitting at home chit chatting or reading a newspaper or enjoying a walk in a garden. I think we have to use common sense and prudence because what is mandated sometimes may not be practical. And as I said, these masks only last for a few hours and you have to change it each time you see a new patient. And also once it gets wet, it's not effective. So if we have 1.3 billion people and everyone needs a mask, sometimes 2 or 3 masks a day, just look at the numbers. Can we ever produce that many masks in a hurry? The answer is no. So let us use common sense, prudence measures, and try to follow the regulations to the best of what is possible.
Thanks, Dr. Ballal. So that common sense, one mask is not enough for one person, I think is something that all of us are missing. And like you said, if we are in the hospital, in ICU, in surgery and so on, we need multiple per day, per person, everyone who's taking care of patients and people who are struggling with COVID-19. And just that idea that one mask is not enough for all of us should perhaps make us think about how we should be approaching this. Not even going towards the side of most of us who are outside may not even know how to use the mask properly. So we might think that we are actually safeguarding ourselves, but might actually end up indulging in more risky behavior just because we have a mask on.
You hit the nail on the head because that should not give you a false sense of security that I have a mask, I won't get the disease. So because the mask has to be worn properly, it has to be effective, it has to be taken out properly, you have to wash your hands before and after placing a mask.
On the same note, I think again, we're talking about the numbers of ventilators we need, how we will never have enough and so on. First of all, ventilators, it's very late in the critical care, right? If nothing else works. So similarly, if a patient suffering from COVID or suffering from other illnesses has to be put on a ventilator, could you give us a sense of what that entails? How long might one need to be on a ventilator for recovery and so forth?
It's like any other acute respiratory distress syndrome, which is basically a severe inflammation and flooding of the lung with inflammatory material and water, which can happen as a reaction to any kind of an insult, most often a viral insult. So ARDS is the final common pathway of destruction of the lungs due to multitude of infections, including viral infections, and sometimes even non-infect reasons could be there. But right now we're talking about respiratory illnesses that cause immense inflammation in the lung, and the lungs get destroyed, filled with water, people cannot breathe, and you need ventilators to push oxygen into the lungs and then to the blood and to the brain. So that is where the ventilation is required. There are standard protocols that are set up by the intensivists as to when and where they need to ventilate, and standard protocols also for weaning them from the ventilator. It depends from person to person, depends on the kind of acute lung injury that you have, your comorbid conditions, or what else is happening in addition to just the respiratory infection, whether you are elderly, heart problem, kidney disease, immunocompromised, so on and so forth. But by and large, usually people who are on the ventilator are there for at least a few days, maybe 1 or 2 weeks, and either may come out of it or succumb. And in any patient who has ARDS with multitude of other comorbid conditions, the outcome is quite poor. One more important thing I want to tell you at this point is that we should not allow this COVID to spread as a panic. People have been dying in much larger numbers of influenza and many other illnesses on a yearly basis, but we don't see the same kind of hype or same kind of frenzy all over the world. And it's very important for us to know whether a patient died of corona or died with corona. Because corona is a viral illness, and there may be multiple other reasons why a patient can get ill and he may also develop corona. So we need to know whether the patient died of corona or died with corona. It doesn't necessarily mean that corona was the only cause of death. So just to give you an example, in our field, see a lot of elderly people, when they die, they do postmortems, they find prostate cancer in their prostates. So these guys have led a normal life and they have died for other reasons, and you have found prostate cancer. So we cannot say they died because of prostate cancer, but they had prostate cancer when they died. So we have to be extremely careful about attributing all deaths to corona. Corona might either be a multiplying factor or maybe a coexisting factor. And that is very, very important for us to know.
Thanks, Dr. Ballal. This with and by, again, a distinction that has been completely lost in our public discourse. We know that the elderly and people with other comorbid conditions are suffering more, but this with and by COVID is just completely lost in the discussion. So similarly, if we talk about kind of personnel needed, again, a lot of these, we are having discussions about what to do if the outbreak becomes much more, if the self-isolation, the lockdown, all the measures that we're taking for some reason fail, right? And we're preparing for worst case scenarios. So in this, in India, we have different challenges that are there in our government healthcare system, and we have a private healthcare system that works alongside it. So in this time of crisis, how do you see all of us sort of coming together? What is giving you hope right now about how people are coordinating and trying to work together?
See, in my opinion, there are three components of fighting this virus. One is the government, which I must admit is doing its best, both at the central and the state level. Second is the private sector, which is not only the health sector, but the private sector in general. And they are also gone out of the way in ramping up their healthcare systems, and huge amounts of funds being committed or spent on healthcare by the various large organizations like Tata, so on and so forth. But the most important link in this fight is the citizens of India. So I think if all three get together, the fight will be a lot smoother and easier. Now, as far as healthcare is concerned, the government has ramped up its facilities. They have opened up COVID hospitals. They're going to open up fever clinics. They are going to set up quarantine facilities. And we in the private sector are working with the government in many of these areas. You probably may be aware that probably the first private sector dedicated COVID hospital with a bed strength of 150 was dedicated by the Manipal Group yesterday in our hometown of Udupi. Our Udupi TMAPI hospital has been dedicated as a COVID hospital exclusively to treat COVID hospitals with a bed strength of 150. Such initiatives are also going to be taking place. Fortunately for us, so far, we have not reached the state where we have to use up every bed that's possible. And we also have to be very careful of not cross infections between COVID patients and non-COVID patients. What has been seen in our experience abroad, especially in Italy, Spain, and others, and China, of course, is that there was up to a 40% chance of cross-infection if you mixed a corona patient with a non-corona patient in a regular hospital. Hence, we have to be very, very careful about sort of spreading corona patients into different hospitals. If it has to be done, preferably you quarantine patients who are not sick outside of the hospital in a OYO or a hotel or a hostel facility that is supervised, or you build or convert hospitals into COVID-specific hospitals. It's not a good idea to mix patients because however much care you take, even in the countries which have had this experience, there's a huge number of cross-contamination, which is something we want to avoid. So I think government hospitals, fever clinics, quarantines outside of hospital, and ramping up of the ICU beds and the ventilators step by step is what we need to do. I would start off. The first step is social isolation, home quarantine, and not moving around unless it's an essential service or an emergency. Fever clinics where outpatients, people don't rush into hospitals. They can be taken care of in a fever clinic or use telemedicine, teleconsults. And people who have milder illness, you isolate or quarantine them in a non-hospital setup. Only the sick with COVID come into COVID-specific hospitals and obviously get into the ICU or on a ventilator in the most unfortunate situation.
Dr. Ballal, thank you so much for giving us so much clarity on this. We are at a time when there's misinformation, different information flowing from various sources, and even those of us who like to think that we can follow and keep up with the news still get lost in this barrage of information that's coming our way. So it's a breath of fresh air listening to you and you're giving us clarity about all of these things. A final question, a personal question, if I may. In these difficult times, what is perhaps the one or two concerns that are most important to you that perhaps keep you awake at night?
What really bothers me is that people will get into complacency if they feel that the disease spread has been contained. they might let their guard off early and be vulnerable to be attacked. So please, follow the rules of the government. The 3 weeks of isolation has a scientific basis for it. Do not let your guard off and do not break the norms which the society has imposed on you for a longer, better good of the people at large. And do not be selfish and think of yourself rather than think of the society. I was quite appalled when I saw there was a congregation of 2,000 or 3,000 people in Delhi at this time, and some 300 people have tested positive. This is the worst thing you can do to the society and the nation. So please don't let your guard out. Don't indulge in these kind of activities. So please be safe. Make sure that your family is safe. And more importantly, make sure that the society and the country is safe.
Dr. Ballal, thank you again for joining us on BIC Talks. It was an absolute pleasure to have you here.
Thank you very much, Pawan and Ravi. It was my pleasure to be here, and we'll certainly keep in touch.
Thank you, Dr. Ballal. Thank you so much.
Thank you.
Dear listeners, thank you for taking the time to listen to BIC Talks. As we conclude our conversation in this episode, I'd like to let you know that we record this podcast remotely from different locations across different devices. As a result, the audio quality of our podcast may dip in a few places, and we request you to bear with us. Thanks again for listening.
Thank you for listening to this episode of BIC Talks. You can get our podcasts on our website, bangaloreinternationalcenter.org, or wherever you get your podcasts. Tune in for new episodes every week. Check out Bangalore International Center on YouTube, Instagram, Twitter, and Facebook. And don't forget to regularly check in on our podcasts.